DC and a busy week. This is part of a series of weekly press conferences that the Association of Counties has been having, featuring stories from the field. We have brought in several county executives over the 6 weeks, 8 weeks that we have been doing these types of events. And we're very pleased to have Congressman Tom Reed from the 23rd District and Congressman Tom Suozzi from the 3rd District on Long Island. Very pleased to have them with us and to share some of their perspectives that they see in Washington, D.C., and also hear a little bit about what folks are saying to them in their districts. A quick update from NYSAC and from the counties. Of course, the executive order requiring workforces to be at 50% capacity expires tomorrow. The governor's executive order for local governments, that is, expires tomorrow. So by Monday, June 1st, if this executive order is not extended, we anticipate county governments, local governments from across the state returning to full capacity. It'll be a little different than it was prior to COVID-19. There may be different hours of operation and services made available to the public. So we want to let folks know if you're going to be accessing public buildings on June 1st, things might be a little different, or things will be a little different than what you might have been used to. Local departments of motor vehicles will not be open on Monday, June 1st. I just want to make that clear. But other county offices and public offices will be open. Municipal employers right now are putting together safety plans in compliance with CDC, New York State Department of Health guidelines, and other workplace safety precautions. So that's June 1st. Also on June 1st is, of course, those regions of the state, I believe there are 7 of them, that will be entering phase 2. Phase 2, of course, is more storefront retailers, professional services, insurance, and the financial industry, administrative support, real estate, rental, leasing. Counties are now being given through their regional control rooms lists of all businesses within their counties and within their region which qualify for both phase 1 and phase 2 if the metrics continue to be met by this time over the weekend on Saturday and Sunday. No region will be open prior to May 30th. So we wanted to report on that. The New York State Legislature in session this week, working to pass COVID-19 related bills, we're working with the state legislature on flexibility for property taxpayers to make property tax payments, working with legislation on providing a death benefit, as the governor mentioned, for COVID-19 frontline workers. And those pieces of legislation will be introduced and voted on over the next few weeks in Albany. Of course, the state legislature working remotely. But this week, the United States House of Representatives returning in person for some critical votes. Here with us today, let's go to Congressman Tom Suozzi and talk to Congressman Suozzi about, you've been an early leader in calling for state and local fiscal relief. Lots of bills have been introduced at this point in time, the HEROES Act, the SMART Act, other pieces of legislation, lots going on with the payroll protection plan for small businesses. Can you give us a sense from how you see things at this point in time?
Hey, thanks, Steve. It's good to see you. Most of you probably know already, I was a former county executive myself and served as with the president of the County Executives Association. A lot of big battles in those days about capping the growth of Medicaid. There was a big victory that we won as part of my Fix Albany campaign. And I'm happy to be joining with you and the other county executives and other members of the association that are here today, and with my good friend Tom Reed, who serves as chairman of the Problem Solvers Caucus, 25 Democrats and 25 Republicans, trying to work with each other to find common ground to try and move things forward. And nothing's more important that we need to find common ground on right now than to try and bring fiscal relief to our states, to our counties, to our towns and villages. And You mentioned that early on, I started pressing for this, Steve, and a big focus of mine has been to make sure that we deliver money to places like New York State that are the hardest hit places in the country. I represent 3 of the 6 hardest hit counties in America: Nassau, Suffolk, and Queens. And this really got my interest early on in the process when we were distributing money to hospitals. And there was $30 billion in the first tranche of money that went out to hospitals, and more money went to the Texas hospitals, which at the time had 2.5% of the cases, than went to the New York hospitals, which at the time had over 30% of the cases. And so I worked very hard getting bipartisan support from Tom Reed and every Democrat and every Republican in New York State to push for a special hotspot fund to be distributed based upon the rate of infection. And worked with Chuck Schumer, and we've got a $10 billion fund. And of that, $4 billion is going to New York hospitals. So there was just a big focus early on to try and make sure that we paid attention to the fact that New York is the epicenter. It's very different in different places, very different in my district versus Tom's district, same as it's very different throughout the country. But New York as a whole has been hit very hard. So I did another letter that was co-signed by every Democrat and every Republican in New York State and New Jersey to create at least a $40 billion fund that would be distributed to states based upon the rate of infection. And Tom Reed was a big supporter of that as well. And that number actually went up to $49 billion in the HEROES Act. So that is something I consider a great victory for New York. But now we need to negotiate between the House and the Senate and between some competing ideas, of which Tom's very involved with the SMART Act proposal, to try and find common ground. There's a lot of things that need to be negotiated. There's a big price tag on the overall HEROES Act. There's a lot of different things in there. But for me, one thing that is non-negotiable, and something I think that is non-negotiable for every member of the New York delegation and other hard-hit states, is to make sure that there is a pot of money that is distributed based upon the rate of infection to our states. Then we need to make sure we're looking out for our counties, our towns, and our villages and cities, regardless of their size, from the smallest to the biggest. And the HEROES Act has a significant amount of money for local municipalities, especially, I want to just point out for the purpose of this call, counties. There's almost $2 billion for the counties outside of New York City to be distributed. Now, I wouldn't get your hopes up because I don't know that that number will end up being the final number, certainly. But I think that it's a good starting point. I was on a call this morning with the Democratic caucus. Speaker Pelosi was talking about the main priorities of the HEROES Act. The number one priority is to honor our heroes, which are the workers that are working in state and local government. That's the number one thing that we are focused on getting done. And we need the Senate to pick this up. We need our Republican friends, especially Republican governors, Republican county executives, Republicans, town supervisors and city mayors and village mayors and local trustees to all be pressuring their Republican friends or soliciting their Republican friends to put pressure on Mitch McConnell, who has said some very unfortunate things about how states should declare bankruptcy and the like, which is just, the height of hypocrisy when they call it a blue state bailout, when in reality, New York State every year sends over the past 5 years, it's sent over $120 billion more to the federal government than we've gotten back. Whereas the state of Kentucky has received $150 billion more than they put in over the past 5 years. So we really need Senator McConnell to start negotiating at least. It doesn't mean he has to agree with everything in the HEROES Act. I don't even agree with every single thing in the HEROES Act, but we need to start negotiating. And one thing that is non-negotiable for me, and I think for most others in New York, is there must be a pot of money, a significant pot of money that is distributed based upon the rate of infection. So I have a whole bunch of other things going on, Steve. I'll take any questions, but those are the one main thing that I wanted to emphasize for this call.
Okay, so let's thank you, Congressman Suozzi. Congressman Reed, you've taken some time on your journey to the United States Capitol, where you are en route to head down and vote. We're very appreciative of you taking the time to join us here as well, representing some areas in rural New York State, the southern tier, a very wide, vast district, 11 counties or so. You've been very involved with the White House. You've been very engaged with the Senate Republicans, trying to carry that message. As Congressman Suozzi talked about the HEROES Act, a lot of good things in that HEROES Act for New York. for New York counties and local governments and hospitals, a lot of testing and contact test tracers funding coming for first responders and public health. You've been very engaged on this with the SMART Act, another proposal. What's it going to take, Congressman Reed? Do you think the three sides will come together here? What do you think the number might ultimately be? There's a couple of different proposals here. We're hearing $3 trillion, as Congressman Suozzi said, that might not make it through. What do you think is going to happen here? And when do you think this might happen? The counties, the local governments are facing some dramatic and rather severe state budget cuts from the New York governor. Should the federal government not be able to help us? Do you think this is going to happen within the next few weeks?
Well, Steve, thanks for having me on. I'm glad to be here with my good friend Tom Suozzi from downstate there in New York, and serve with him on the Ways and Means Committee, and he's a great addition to the committee. So I've enjoyed working with him in his new tenure here in Congress. And you know, we've been talking about this. I've been involved in the state and local issue from day one. Almost 70 days ago now, we started to get involved in this, being a former mayor. When these crises, such as this natural disaster, impacts an area, that we got to make sure that we're moving quick and we're trying to give relief where relief is needed. And so we were in negotiations in phase 3, working directly with our Senate partners. I can remember vividly an evening call at about 10 o'clock talking to John Thune in regards to that initial pot of money, that $150 billion that wasn't even going to be contemplated in regards to what was negotiated in CARES Act 1. And we were able to crack the door open in regards to state aid there, and the population of 500,000 and more being included with that $150 billion. Now I do believe, you know, the governor of New York is sitting on $5 billion that should have been distributed to the counties. Other states are honoring the legislative intent of CARES Act 1 that distributes that money to the local governments. But the governor of New York and some other governors have decided to ignore that and sit in that money in the state capitol. That being said, I'm looking forward. And so over the last 60 days, as you know, in direct communications with you, I've reached out to the National Association of Counties, U.S. Conference of Mayors, had a great call with the National League of Cities yesterday. Been working with the White House, been working with Mitch McConnell's team. And I think the reality is what you're going to see is a state and local aid package put together that is going to honor a couple of things. One, making sure that there's direct local assistance to our local governments, like our counties, like our cities, like our villages, like our towns. That's what the SMART Act was all about. Partners with Senator Cassidy, a Republican from Louisiana, and New Jersey Democratic senior senator, working together. And I really do believe there's a sweet spot there. And you know, the SMART Act is $500 billion worth of state and local aid that's distributed directly to local governments, as well as direct assistance to the state. And so, you know, I think there's a compromise there to be had. I think all sides will recognize that that aid needs to flow to our local governments. And just like in national recovery, that is the appropriate thing to do. And well, a couple of things that we put in the SMART Act in order to bring bipartisan support to this is to make sure that there's no pre-existing budgetary conditions that are piled up into this proposal. And by that, what I mean is it has to be related to the COVID-19 situation. It's based on economic loss, revenue loss, that's related to the quarantine orders. It's based on population. And as Tom Suozzi indicated, a tranche of the SMART Act money will go to those COVID-19 infection areas that obviously particularly hit New York more than other states in the union. As to time frame, I really think what you're looking at is the HEROES Act is dead on arrival, and I disagree with my friend Tom Suozzi in regards to negotiating with the Senate with the HEROES Act. The HEROES Act is viewed, in my opinion, on our side of the aisle and in Washington, D.C. as a partisan exercise. So it wasn't put on the table in good faith. It wasn't done in a negotiating fashion. What's going to happen, and I've been in Congress for 10 years now, and I've seen this play when John Boehner was Speaker and Harry Reid was the leader of the Senate. What you're going to see is the Senate take up a bill. They'll get about 70 to 80 votes, and I think it's going to be very difficult for the Speaker to turn her back on that proposal once it gets that level of support. And in there will be state and local aid. Obviously, the dials are always something that you're going to be looking at. You know, 100 billion. You know, that's a mark on what Moody's is based on some reviews of the actual damage is to our local government states. And so I think position substantively, we didn't just the board and say, okay, let's cut this act in half and say this actually working at this, like I said, for 60 days and the $500 billion of recovery. I see middle of June and the final is it will act, and then it will the speaker wants to eat and pass the Senate with any disrespect to my good friend on the other side. But having seen this first roll happened repeatedly, and I just see that type of regards to level of bipartisan support. So,
we're having a bit of an issue with the audio and the video with Congressman Reed right now. When we get Congressman Reed back in, we'll have him re-engage with us. Having a bit of a audio problem with Congressman Reed. Let me say this, Congressman Suozzi, while we're waiting for Congressman Reed to reestablish a connection here, and hopefully that'll come in soon. You know, and then we'll go right to the media partners here in about 2 minutes here. Maybe you don't have to respond to me, or as we're opening it up to the media partners, you can maybe discuss this a little bit. To me, it seems like as we went into this situation here, it was all about New York, and that the Congress of 435 members of the House, another 100 senators on top of it, it seemed to be all about New York, and the country didn't want to, quote unquote, bail out New York. That New York had its own problems, and why should we help New York? And I guess as Mark is going to open it up to the media partners here, I wanted your reaction to that. Is there a sense of more states which are seeing more infections now and more activity with this COVID-19 virus? Is it beginning to change a little bit within the House of Representatives? Are congressmen starting to feel the pressure in their communities from the devastation that this virus could inflict upon their state? And is there a little bit more sympathy or understanding of the issue for New York State as other states come into this problem? And Mark, you can unmute the phones now and we'll start taking questions as Congressman Suozzi perhaps gives a quick answer to that.
So there's no question that New York is harder hit than anywhere else in the country, and it's been that way since the beginning. However, as you point out, it's getting more difficult in other places throughout the country. We've gone from having over 35, almost 40% of the cases at one time, to now having about 21% of the cases. So other states are being hard hit. Certainly New Jersey's been hit hard, and Pennsylvania, and Louisiana, and Minnesota. There are other states, there are Michigan, Illinois, other places that have been hit hard as well. It's like everything else. You have to constantly work with your colleagues. The country is very different from place to place. It's very different in a rural community versus an urban community. It's different in a suburban community, quite frankly. The demographics have a big impact. And that goes with everything in government. That goes from everything we deal with, like the salt tax. You know, the salt bill to remove the cap on the salt deduction is a big part of the HEROES Act right now. We're going to try and keep that in the negotiations going forward. Tom Reed said a couple different things, two of which I want to just respond to. One, in defense of the governor in the state of New York. I mean, they're in a massive financial crisis in New York State, not because of pre-existing problems, not because of mismanagement, not because of blue state, but because of the shutdown has caused a massive loss of revenues. And that is it's hitting every place in the country, but it's hitting New York particularly hard. In addition, we spent a tremendous amount of money on responding to the coronavirus itself. That cost a lot of money for our states. It actually is affecting our counties dramatically as well. As a former county executive, I know how this is affecting or health departments, for example, or if you're responsible for a police department, certainly that would be a big issue, as well as having other public facilities like a jail that you have to oversee or a public hospital. So there's so many different factors that affect our local governments that have to be addressed. And as far as the bill being dead on arrival, I mean, so the Senate passed a one House bill about a month and a half ago, the CARES Act. Everybody said, hey, Nancy Pelosi's got to move, she's got to negotiate. Well, we're doing the same dance now. The Nancy Pelosi and the Democrats passed the one House bill, and we're saying, hey, Mitch McConnell, you better move. And, you know, waiting until the middle of March to begin negotiations is not responsible when we're facing this crisis. I just heard a statistic this morning that there have been more layoffs by state and local governments during the coronavirus pandemic than there were during the entire Great Recession. So we don't want that to happen in New York. We don't want that to happen to our heroes. We don't want that to happen to our state or to our counties or our cities or local villages. So we've got to get this negotiation going.
I had the worst problem in the nation.
Okay, so Mark Levine, do you have questions from the media partners that are with us here today?
Please, if you have a question, please raise your hand at this point and we will unmute your line. Right now, all lines are unmuted. So if you have a question, please indicate so.
Like, I just hate it because it's like he always tosses like that.
Some people are talking right now, and we can hear you talking over the phone.
Dude, just fill the other 10 minutes.
I think you might need to
Just
mute
take
the phones.
like 5 more questions.
Okay, if you have a question, please indicate so by raising your hand. If you do not have a question, I will go back to Stephen Acquario.
They can do that in the chat room, right? Or they can.
They can. They have not. They haven't chosen to do so at this time. You can send me a question via chat, or you can raise your hand, and I will call on you in order of the questions raised. Stephen, we don't have a question, so if you have another question for Congressman Reed.
Let me just talk about, Steve, while we're here. You know, we're down in Washington.
Hold on. If I could, Suozzi, you've already responded to a couple things.
Yeah, go ahead. We can't even see it. We can't even see it. Put your camera on. I want to see that beautiful face.
Of where people devastation. Can you hear me?
Barely.
You're coming in and out, Congressman Reed.
In and out.
Oh, there you go.
So I got full thing. As to the mood of the country, the country's being in. You have the healthcare virus going off, which obviously hit New York, but you also have the going off as a result of the flying.
You're going in and out, Tom. Can't hear you, Tom.
Congressman Suozzi, the activities of the House this week, what's happening this week right now? Do you expect to do payroll protection plan changes to that? Do you expect small business owners to have to loan forgivenesses? Are there issues with bridge loans for small businesses? Where's the sense of the House this week?
One of the biggest issues we're facing this week is to address the PPP program, which are the loans to small businesses that could result in being grants. And it's to provide more flexibility to the small business owners that instead of having to spend the money within 8 weeks, they could spend it within over a period of 24 weeks. In addition, instead of 75 payroll, 25% other, to change that number to 60-40 and to give more flexibility to the small businesses. I talked to so many restaurant owners that really are not, they know that when they reopen, they're going to be stuck with building up their business. It's not going to all come flooding back right away. And they're going to face 25%, 30% of business, 40%, 50% over a period of time. So they need more than 8 weeks over which to spend the money. They're not asking for more money. They're just asking for more flexibility. So we're passing in the House this week, tomorrow, or today maybe even, flexibility for the Paycheck Protection Program. Several members of the Senate, several Republican senators said they didn't want to go home last week without
I got overheated.
without passing a similar flexibility act. However, they weren't able to get it done. We need to put pressure again to get these folks to start negotiating on all these different things. For me, the most important is state and local money, but also for flexibility for the PPP program as well. There'll be other issues that'll come up as well related to the Chinese treatment of the Uyghurs. There's over 1 million people in forced labor camps in the western part of China. There'll be some other national security issues that'll be discussed. So there'll be quite a bit of business going on today and tomorrow. We may slip, I can't maybe come home till Friday, but we're not sure yet. But again, we need to put pressure on to get this negotiated regarding the state and local governments.
Congressman Reed, are you back on?
Well, Tom, I can't say that I'm upset that only I can talk and you can't talk.
Well, you're used to it. You're a typical downstater New Yorker. I know how
Or
you
you came back for that one.
I came back for that one. I love Tom Suozzi, but I will tell you this, and what I was trying to articulate was that the mood of the country is changing in the sense of the virus went off separately, but the quarantine orders and the shutdown orders is impacting everybody equally. And so that is bringing people together to recognize state and local aid is going to be something that needs to be done across the entire nation. And so I think that's unifying the country. And I think that it bodes well for us getting a solution to this put together. But one of the things I do want to touch upon is the pre-existing budgetary condition argument. It is not helpful, in my humble opinion, and I've heard it from Republican colleagues that have pointed to the governor's own 7-day span of going from $13 billion of economic recovery necessary to get through the coronavirus situation. And then 3 days later was $35 billion. And then 2 days after that, it was $61 billion. That played right into the argument that people are using this resource, this aid, for things outside of the coronavirus situation. And so I encourage folks, if you have an opportunity to weigh in on the coronavirus-related expenses, related economic revenue loss, and put a calculation based on things that Moody's and others are putting the price tag at. And I think when you do that, it bodes well for us to bring people together and get something to the finish line. And so we do have to deal with that pre-existing budgetary issue. You even see it in the state budget. You know, they covered a $6 billion hole on paper with the Medicaid FMAP increases that were used to kind of paper over that result. And then also the education cuts that are being held over our local school districts in the state capital that were relieved with $18 billion that went to the state in regards to CARES Act that has already been there. So all those gains are not helpful to the situation, in my humble opinion. But because, you know, we got to get this done, I just want to make sure people are aware of what's being utilized in a way to be in opposition to supporting this relief. So if we can just stop with the budget shenanigans and just be straightforward with the American people, the generosity of the American people will make sure that we get New York taken care of, as well as the other areas of the country that need that direct local government relief in particular.
Let me ask a quick question, Congressman Reed, on the Municipal Liquidity Fund. This is a technical term here. This was part of the U.S. CARES Act that was passed that enables large counties like Nassau and Suffolk, where Congressman Suozzi represents. Some of the smaller local governments, counties, local governments around the state have to do borrowing through this pandemic period here. The Municipal Liquidity Fund enables the Long Island counties and larger populous counties to take advantage of some interest-free or low-interest borrowing through the Treasury. Are you going to be able to help the local governments and make some adjustments so that smaller jurisdictions can take advantage of this borrowing
Absolutely.
fund?
Yeah, I've already talked to the Treasury Secretary. Obviously, this is put up by the Federal Reserve, and so we talked to Chairman Powell, sending a formal letter to them to make sure that the flexibility is open from that 250,000 population threshold upon which you refer, Steve, and making sure that even smaller governments, all the way down to zero, if you would, is where I'm asking them to go. That we make sure that every one of the municipalities has access to those borrowings and those bond costs at historic low levels that the Federal Reserve has put up. And so I'm very confident in my initial conversations with them that relief will be coming. But it's just a matter of getting it through the system and making sure that they hear us loud and clear that the small governments need to be taken care of. Just like in the state and local aid, 500,000 and larger population. I know a lot of Suozzi counties have already received some of the relief because they are that population level. We need more to the local and smaller municipalities, obviously, and that is not only true for the liquidity fund for the financing purposes, but also for regards to the state and local aid assistance that we're trying to get together.
Congressman Suozzi, let me ask you this.
Let me just respond to one thing, Steve, if I could. I just want to point out that, we sent a letter to Secretary Mnuchin with every Democrat and every Republican in the Long Island area seeking that opportunity to borrow for the counties that I represent downstate. And I'd be happy to participate in helping to build a bipartisan coalition to try and lower that threshold even further to help other folks in New York State. The more that we can do together with Democrats and Republicans working together, the more effective we're going to be in getting things done. As far as the Tom's claim earlier about budget shenanigans, I've seen every state adjust their figures as the pandemic has gone on, especially if they've tried to figure out their revenue losses. One of my big concerns is when distributing money to small villages and cities and towns and even some counties, they're going to have a hard time figuring out their revenue loss numbers. So I think that using CDBG formulas is a good way to look at how to distribute money directly to local governments. What would you want to ask, Steve?
All right, before I get to that question, I want to answer one question that came in. Do we think the Memorial Day events, the releasing of the executive orders with respect to non-essential mass gatherings, of course, the governor bringing some flexibility there, allowing folks to gather 10 persons or under, and the activities of the individuals. The question is, will that limit the reopening up to phase 2? I do not believe that that is the case. The CDC, the New York State Department of Health, our governor talking about a 2-week sort of incubation period and phase. So we need to look at the metrics as we get into Friday and Saturday. And the governor saying he's going to look at those metrics, and the regional control rooms will continue to look at the rate of infection and to see if, in fact, there have been some abnormalities in those dials, if you will, as we get closer to Monday. But I do not anticipate that slowing down the reopening into phase 2. The question I had, Congressman Suozzi, is this. The New York governor going to D.C. today. You may see him in the halls. He's an imposing figure. He's bringing a message from the people of the state of New York to the President of the United States. And that message, we need to get back to work. He's bringing a message of infrastructure investments. He outlined yesterday to the people of New York State some of the projects that he would like to do. How do you see, and the same question will go to Congressman Reed, how do you see infrastructure being attached to this discussion? Do you see this as part of a COVID-4, a state and local fiscal relief where revenue losses are being affected here? Do you see infrastructure projects being attached into this next round of discussions?
I certainly think that we have to do a massive infrastructure bill. We've needed it for years. We've been talking about it for years. It's got to get done. Nobody wants to pay for it. Can't find agreement as to how to pay for it. Everybody agrees it needs to be done. They just wouldn't pay for it. I'll consider any way of getting it done, and I want to get it done quickly. However, I think that the state and local question is much more urgent and needs to happen immediately and cannot wait for the negotiation of an infrastructure deal. I do think that there's great hope that there can be a massive infrastructure deal. I don't think we should wait on getting the state and local piece done. That has to be really done urgently, right away. Too many local municipalities, too many states are suffering and need this help immediately. So we need to begin negotiating that right away. But Tom will tell you, we've worked together on the problem solvers, negotiating on ideas for infrastructure for the whole time I've been in Congress, which is now, whatever that is, 3.5 years. We need to do it. I'll consider any reasonable offer anybody has about how they want to get it done. It must be done, not just for the big projects the governor was talking about related to Penn Station and related to other massive projects like subways, but also water and sewer issues throughout the state. Different ideas related to roads and bridges, green power, broadband. Tom Reed can't speak most of the time. He doesn't have enough broadband where he is. So we have to figure out how to get more broadband to different communities. I'd like to see a green energy proposal as part of it to try and facilitate that. So I'm very much in favor of an infrastructure plan. I would have told, if you asked me before the pandemic, could we get an infrastructure deal done in 2020? I would have said absolutely not. It's dead on arrival, too much politics. Now, because interest rates as low as they are, because we need the stimulus, and because everybody wants to get something done, I think there's a possibility.
Congressman Reed, as Congressman Suozzi mentioned, broadband is an issue in rural New York. In your area, there's a disconnect for online learning for children in school districts. It's really unfortunate that people don't have access to the internet, that our students don't have access to the internet. What are your thoughts about infrastructure funding as part of these discussions? Do you think it happens on a standalone bill, or do you think it happens as part of a COVID-4?
Well, yeah, I think an infrastructure project right now, the infrastructure deal, and I would agree with Tom Suozzi in regards to this. I mean, there's broad bipartisan support for an infrastructure deal. We did it in the Problem Solvers Caucus. I co-chair on the Republican side. Those 25 Republicans, 25 Democrats on their side that have committed to come together. And we have supported infrastructure deal. And even our back to work checklist that we put together as a group gave to our 75% consensus to support it, to give the seal of approval of the Problem Solvers Caucus. Infrastructure was part of the economic stimulus portion of it to go forward. And so it's not just about roads and highways. It's inclusive of looking over the horizon the next 50 years, 75 years. What are the infrastructure investments that are necessary for us to go forward? And broadband is obviously right in the middle of that. And so I would agree with you that there are still deserts out there in regards to infrastructure needs across the country that need to be filled in. And I'm glad to say we built out some successes, though. Even in the telemedicine, we were able to get $250 million put on the table in regards to having our hospitals and healthcare networks be able to put in access to the internet to provide for telemedicine. We just did $10.3 million, for example, in one of our counties, Yates counties in the district, off an FCC grant in order to utilize existing money to put in broadband. So there's money out there, and I think you'd see a continuation of that in the infrastructure bill as we go forward. So is it going to be in the next package? Maybe, maybe not. It could be, but I do believe there is an appetite for an infrastructure project this year, given the fact you got 0% money, you got 0% dollars out there. If we're going to make that $1 trillion investment, which I think is very doable, $2 trillion may be a little too far. But I think you could piece together public-private partnerships with some additional revenue sources, because one of the things you don't want to do is raise taxes, and that's why I don't support the gas tax increase, especially in a time of economic contraction like we're seeing right now. We want the economy to grow, and you start putting a $1 trillion plus tax increase on people's back, you'll see the economy even further shrivel up. But we got to grow this economy, not shrink it.
We had a question come in, your thoughts on municipal furloughs going through the pandemic. Municipal governments have had to furlough. A lot of private sectors had to lay off employees. Is this resonating in the House? Is this something that is of concern to the members around the country?
Listen, as I said earlier, there have been more layoffs.
I think you're seeing it. I think you're definitely, I mean, obviously the furloughs in municipal and the private sector is something that everyone involved, and it's also a reason why we got to look at this as a recovery from a natural disaster. That these investments are necessary to keep people not only working, but also to make sure that they have an opportunity to come back and have a job as we go through the recovery and rebuild America.
Congressman Suozzi?
Yeah, as I said earlier, there have been more layoffs from state and local governments during the coronavirus pandemic than there were during the entire Great Recession. It's a big problem. I'm very concerned about it. It's the #1 priority right now of 3 of what the Democrats are looking to try and get done. 1 is to take care of our state and local workers. 2 is to reopen our economy with a massive investment in testing. I think we need to be doing much more testing than we're doing, not only for people with symptoms, but people that are asymptomatic, especially when we have contact tracers. identify people that could potentially be exposed. And additionally, we need to test people for antibodies to find out if they have a less likelihood of getting infected again because they've already recovered from the coronavirus. And third is put money in people's pockets, whether that's people on unemployment or it's people that, whether we should consider stimulus checks again. So I think we need to get moving on getting a deal done.
Okay. To Mark Levine, are there questions from our media partners?
There's
I
a
saw one
question
question
from
in the chat room.
Candace. Candace, your line is now unmuted.
From Newsday.
I'm trying to unmute your line, Candace.
She could probably unmute herself.
Hi
now.
there.
Hi, we hear you.
Hi. Thank you so much for your time. Hi, Congressman Suozzi and Reed. I just had a question. There's so much talk about a second wave of the virus, and I'm wondering if when planning any of these state and local government support packages, if that's being taken into consideration. Does that factor into some of the projections on the cost or the revenue loss, or even another possible mini shutdown of any kind, or a pullback, or longer periods of time between phases? I know that there are people here, at least in Nassau County, who are very nervous about that. Thank you so much.
I'll go first, if that's okay, Tom. So there's going to be a definite second wave of the virus hitting again. I think that what we have to do is learn as much as possible, do as much as possible, change our behavior as much as possible between now and then, so it doesn't become the crisis that it is, that we just went through. That means we have to wear our masks. That means we have to do social distancing. That means we have to be much more careful than we were this first time around. And we have to figure out how to do the things that all the experts tell us we have to do. We have to do more testing, not just of people with symptoms, but people that are asymptomatic, who've been exposed, as well as people for antibodies. We need to have contact tracers. If someone's infected, who else have they come in contact with? We need medical detectives to go out and find out who else they've come in contact with to make sure we can test those folks, even if they're asymptomatic, and to see if we can get them to isolate as well. So again, testing, tracing, isolating. Wear your mask, wash your hands, social distancing. We can avoid this from becoming a big crisis again by learning the lessons of what we've been through. We can't just jump back to our same behavior before. That's why this phasing process makes sense. I'd like to see it happen as aggressively as possible. I'd like to consider the possibility of the governor shortening that 2-week period, depending on what the statistics are and depending on what people's behavior is. If people are behaving responsibly and are wearing their masks and social distancing, and we don't see a rise in any infections, that we can try and move aggressively to reopen. But we need that testing, tracing, and isolation as part of it.
Congressman Reed, do you want to respond to conclude the interview today?
Well, I love when Tom Reed gives me the last word.
So I will tell you that I would agree that we have to learn the lessons of COVID-19 shutdown in regards to social distancing and masking. But one of the other things that we've learned is how to repurpose our supply chain, make sure there's redundancy in the supply chain. We are already in the process of reestablishing and supplying the national stockpile. And I believe and I hope the state is doing the same with the state stockpile, so that when this virus comes back, and the good news is the virus, every public health briefing I've been receiving, the initial concern is we were supposed to have 2 million dead by now in America, because they weren't sure exactly what the virus would be doing. And they were concerned of it, some early indications of it mutating up and becoming more aggressive. And obviously, we've seen a different outcome. A lot of that has to do, obviously, with social distancing, but it also has to do with what Mother Nature's done with this coronavirus from the public health experts that have briefed me. And we're seeing the coronavirus do what they typically do. So there is going to be, in my humble opinion, based on those briefings, that wintertime reemergence of the virus. But we learn from the shutdown situation. And because we'll have the supplies, we'll have the redundancy and supply chain realignment, that bodes well for us to be able to survive this bounce back of the virus, and the virus taking its natural course that we're seeing, where it's not mutating up, it's mutating down. which tells you that that it looks good in the sense of any type of winter type of reemergence is going to be one that we typically could anticipate. And because we learned the lessons of social distancing, masking, and supply chain and PPE delivery, and having those national and state stockpiles replenished, that will hopefully mitigate any adverse consequences and avoid any type of shutdown that we do not want to see happen on a mass scale come this winter.
And we all pray that there'll be a treatment by then also.
Yeah, we've been briefed in the Problem Solvers Caucus, and I know Tom's been involved in this. The emerging technology on vaccine and treatments has been amazing. The cutting of the red tape at the FDA and other areas has brought to light multiple vectors of treatments and vaccines that we have not seen the speed of development of this nature in the history of America. And so that bodes well for us being in a position of treatment and vaccine sooner rather than later. That will obviously help us a great deal also.
Well, I'd like to thank both congressmen from the state of New York, Congressman Tom Reed from the 23rd District, Congressman Tom Suozzi from the 3rd District on Long Island. Thank you so much. I pray for you. I pray for New Yorkers. I pray for the lives that have been lost and the lives to be saved. And thank you for all you're doing to support the state of New York and all that goes with it in the United States Capitol. Thank you very much, Congressman.
Thanks, Steve.
Thanks, Steve. Take care.
I'll see you later today, Tom.
Yep. See you, Tommy.